Hello guys, welcome back. So today we're going to be doing, not today, in this video, we're going to be doing the external nose, nasal cavity, paranasal sinuses, maybe the soft palate, if you can try and push it in. You can just give it a different video, a separate one. Okay, so first I want to discuss the nose. These are from my notes in the previous year. And then so what the nose is made up of externally is the root, dorsum, so the root, dorsum, tip, and the nostrils. The external nose, the upper part has the nasal bone, has the frontal process of the maxilla, the nasal process of the frontal bone. Okay, and they're shown right here. The lower part, upper lateral nasal cartilage, right here, major alar cartilage, and the minor alar cartilage. And finally, the subcutaneous tissue of the nose. How the blood supply to the nose is mainly by the dorsal branch of the ophthalmic artery, alary and septal branches from superior labial artery and the infraorbital artery. And the innervation here is the infraorbital nerve from the anterior ethmoidal branch and the infratrochlear nerve. Now that's basically it for the external nose, very quick and easy. Now we're going to just dive into the nasal cavity as a whole. There's a lot of things to discuss in this part, but hopefully we can get it through very fast. So nasal cavity, basically it's the cavity that is superior to the soft palate and the hard palate. That is where the air breathed through the nose enters. So the cavity of the nose divided into right and left halves by nasal septum. Each cavity opens on the face by the nostril and opens posteriorly onto the nasopharynx by the posterior nasal aperture, the choana. So the choanas are the superior, middle, and inferior, and they are structures that help to humidify the air that is going in, and it contains the nasal meatuses, I think, as far as I know, the spaces between those choanas. And so the air passing through this gets humidified. And so the most posterior aspect of the nasal cavity is the nasopharynx, so this most superior part of the pharynx itself. So the pharynx is divided into many parts. Part of it is nasopharynx, oropharynx, and the laryngopharynx. Boundaries of the nasal cavity. The roof has the following parts: anterior sloping part formed by the nasal bone. Okay, the anterior sloping part, nasal bone. Middle horizontal part formed by the cribriform plate of the ethmoidal, right here, cribriform plate of the ethmoidal. Posterior sloping part formed by the body of sphenoid plus ala of the vomer, right here. Okay. And so the floor is formed by the hard palate, as we all know here. And the medial wall is the nasal septum, is formed by the septal cartilage anteriorly. Okay, right here, septal cartilage anteriorly, perpendicular plate of the ethmoidal bone, right here, and the posterior-superiorly, of course. That's the nasal septum cartilage anteriorly, and posterior-inferiorly is the vomer. The vomer bone. That's the medial wall. The lateral wall is made up of irregular, and shows the following. They're irregular because of the nasal conches, but lateral wall is made up of the vestibule, a small dilation above the nostril, right here. That's the vestibule. The atrium, a shallow depression above and behind the vestibule. Okay, that's the atrium. And then the nasal conches, middle, inferior, and superior conches. And you can go ahead and read about them even more. The conch is covered by a thick, highly vascular mucous membrane. Just remember that. Nasal meatuses. Nasal meatuses are just the spaces within and between the conches. So superior meatus is between the superior and middle. Middle meatus is between the middle and inferior, and the inferior meatus is below the inferior concha. The superior meatus, so just to revise them again, superior meatus is a narrow space lying below the superior concha. It receives the openings of the posterior ethmoidal air sinuses. Now, This is where we are discussing how the paranasal sinuses empty and where they lie. And this is very important because that's where Swirsky wants you to know how those the paranasal sinuses end and where they open. The paranasal sinuses are basically openings within bones. And so these cavities open in spaces that are within the nasal cavity, and those small spherical spaces should be known. So the superior meatus receives the openings of the posterior ethmoidal sinus. So we have from this saying is we have the posterior part of the ethmoidal paranasal sinus empties or opens, and at the superior meatus at the place called the posterior ethmoidal sinuses. So the posterior ethmoidal sinuses opens at the superior meatus. That's the message. The middle meatus lies below the middle concha and shows the following features: bulla ethmoidalis, hiatus similunaris, and bulla ethmoidalis, a rounded elevation on which the middle ethmoidal air sinuses opens. Okay, bulla ethmoidalis, middle ethmoidal air sinus opens here at the middle meatus. Hiatus semilunaris, a crescent groove below the bulla, receiving the openings of many things: anterior ethmoidal air sinuses, frontal air sinuses, maxillary air sinuses. And finally, the inferior meatus runs below the inferior concha and receives the opening of the nasal lacrimal duct. Remember, these openings right here of the paranasal sinuses into the nasal space is very important, and you have to know each paranasal sinus where it opens. Okay, and then finally, sphenoethmoidal recess, a triangular fossa between the superior concha and the roof of the nose. It receives the opening of the sphenoid air sinuses. Sphenoid air sinus. You see here, paranasal sinus. The paranasal sinuses are basically the frontal, the ethmoidal, the maxillary, and the sphenoidal. And we have discussed and seen where each and every one of them opens up. Now, for the ethmoidal, it's made up of three parts: the anterior, the posterior, and the middle. The middle opens up at the anterior ethmoidal opens up the hiatus semilunaris. The middle part opens at the bulla ethmoidalis, and the posterior part opens at the superior meatus. Now, for the frontal sinus, now if we finished one of them, now the frontal sinus is located within the frontal bone. The ethmoidal, of course, is located with the ethmoidal bone. Frontal is located within the frontal bone, and the frontal air sinus opens at the hiatus semilunaris at the middle meatus. The maxillary air sinus is located at the maxillary bone and opens at the hiatus semilunaris in the middle meatus. And then finally, the sphenoidal, which is found within the sphenoid bone and opens at the sphenoethmoidal recess, which is found between the superior concha and the roof of the nose. So these are basically the summaries of the paranasal sinuses and where they open, the external nose, and the nasal cavities and the nasal cavity features that we have to discuss. Now we're going to discuss the blood supply of the nasal cavity, the arterial supply. We have so many things that supply the nasal cavity. First, we have the anterior and posterior ethmoidal branches of the ophthalmic artery, sphenopalatine branch of the maxillary artery, brachial palatine branch of the maxillary artery, septal branch of the superior labial branch of the facial artery. These are to be memorized. If you can't memorize all of them, 2 or 3 is enough. Venous drainage by veins accompanying the arteries, which with rich arteriovenous shunts. And that's basically it. So they're labeled here for you. You can just know the vascularization of the nasal cavity. Nerve supply of the nasal cavity. There's a lot of things to be discussed here, and we can just go over them very quickly. Nerve supplying the lateral wall. Olfactory nerves. Why? Is because the olfactory nerves take up the function of carrying smell sensation. The branches of the trigeminal nerve carrying general sensation, such as the anterior ethmoidal nerve and the nasal branch of the anterior superior alveolar nerve, the short sphenopalatine nerve, and the greater palatine nerve. They carry general sensations. Nerve supply through medial wall, olfactory nasal scores carry smell sensations, and then branch of trigeminal nerve, again, middle inferior nasal branch of the anterior ethmoidal nerve, the long sphenopalatine nerve, and the short sphenopalatine nerves. And these are enough to be mentioned for Swirsky if you guys want to just dive into details of the nerve supply of the nasal cavity. The lymphatic drainage of the nasal cavity written here. I don't like to study the lymphatic drainage. Maybe it's important for the future, but I didn't pay attention to them. That's what I did. Next, we're going to discuss details of the paranasal sinus, which I already have gone through, but why not? So the definitions: they are air-filled spaces inside the skull, linked to the nose, and they open the lateral wall of the nasal cavity. Functions: they diminish the weight of the skull, give resonance to the voice. Of course, they're spaces so the voice gets amplified, and humidification of air and protection of the brain against changes of temperature. And they're basically the frontal sinus, ethmoidal sinus, sphenoidal sinus, and maxillary sinus. Frontal within the frontal bone, ethmoidal within the ethmoidal bone, sphenoidal within the sphenoidal bone, and the maxillary within the maxillary bone. Paranasal sinuses include those things right here, and plus the maxillary air sinus. So much detail about the maxillary air sinus because of how the shape is of it within the maxillary bone. I haven't discussed everything related to those, but why not? Let's just go over it one more time. Sphenoid air sinus is inside the body of the sphenoid bone. It opens in the posterior part of the sphenoethmoidal recess. Remember, it's between the superior nasal concha and the roof of the nasal cavity, I think. And the frontal air sinuses, one behind each superciliary arch. Right here, you see those two things in my skull. I'm a bony guy, just you can see it right here. These are the location of the frontal air sinuses. It opens in the middle, in the hiatus semblanus, so the small opening of the middle meatus of the nose. Ethmoidal air sinuses made up of anterior, middle, and posterior group inside the ethmoidal labyrinth. That's where it's located. Posterior group opens into the superior meatus, while the rest opens into the middle meatus. And we have discussed where exactly they open in the middle meatus. The maxillary air sinuses site is it fits the whole shape of the maxilla, is the largest paranasal sinus. Shape of and relations is pyramidal in shape. Apex, basal, roof, lower, anterior, and posterior. You can all dive into this if you want to, but it's not necessary. You have just to know the opening of the sinus, straight and high, up in the middle wall, base, and opens into the hiatus semblanus of the middle meatus of the nose. This is the most important part of it. Nerves related to the sinus. You can dive into it, but I did not. So I think the only thing you need to know is where it opens and where they are found and with the functions of it, and you'll be fine. Done related to those. Now I'm just gonna probably stop it here and make a video for the soft palate and then dive into other stuff right here. Holy crap, that's a lot of content.